All right. Good morning, ladies and gentlemen. Is my mic on? Okay. Good morning, ladies and gentlemen. Thank you very much for tuning in for day 4 of the Kampala Innovation Week. My name is Cynthia Chofna, and I'm happy to be doing this with
Martin Bakene.
Okay, so today we are going to be talking impact, and there's quite a lot that we have to take home. But Martin, I know that you were part of the sessions that happened yesterday. Tell me what happened.
Well, yesterday's main subject theme was sustainability. And if you'd like to see everything that went on, I'm sure we have links to recordings that are up on our social media platforms. You can also, I'm sure you're already up on our website. You'll be able to find links to the social media pages of everyone that was on a panel and all the exhibitors. I encourage you to go back and look at some of that. On the broader scale though, our theme for this year is innovation and entrepreneurship for Uganda's digital transformation and job creation. We're looking health, agriculture, education, and the creative sector.
Great. Thank you very much. There's quite a number of sessions. I wouldn't want I wouldn't want you that's watching us to miss any of that. You can visit Hubilo. We're streaming live on Hubilo. You can also visit Startup Uganda YouTube channel, so you can catch up on all the previous episodes from day 1, day 2, day 3 up until today, day 4.
Absolutely.
So we won't waste as much time. At this moment, you know the theme this month, most of it is really us talking growth, yeah, and scale. So at this point, we are going to invite Allen Arinitwe. She's going to then invite her panel, but her panel is going to be discussing job creation and the health sector. How can we better incentivize exiting and potential health workers?
Absolutely.
You know, health is a topic, a hot one in Uganda.
And
So
people
Allen,
are afraid to go into it.
yes. So Allen, please come on up, invite your panel, and we look forward to that session. If you are tweeting, please use the hashtag KIW2021, so we can see all the engagement that is going on. Martin.
Good morning. So my name is Allen Arinitwe. I'm a programs consultant with Hive Collab. And today we are really the ones in charge of today's morning session. So I'll go ahead to invite my panel, and then we can go into the details of who we are. So I want to welcome Wilson Kutegeka. Please come on. Wilson is from the Clinic Masters. I will be talking more about that. I also want to welcome Riyonga Daniel. He's the founder of Teheka. Please take on the stage. Our next panelist is Edmund Mwebembezi. He's a communications officer with the World Health Organization in Uganda. Welcome, Edmund. Our next panelist is Arnold Byargaba. He's from the MasterCard Foundation. Our next panelist, who is virtual, is none other than Alex Kahana, and he's from Impact Rooms in the UK. So he was around, but he just left like a day ago. But he'll be joining us on Zoom. Yeah, and so thank you, gentlemen. Yeah, and of course, ladies first. So yeah, I'm going to take on the stage. So my name is Allen Arinitwe for the community and the community online. The program's consultant with Hive Collab. Hive Collab is the first and the leading hub in Uganda. Hive has been in this space for the last 11 years. So the other guys are really our children, but who have really grown up so well and have taken on responsibility effectively. In this session, we're going to be talking about growth. Professionally, I'm an Agile Scrum Master, and so I'm really like a tech person, but yeah, so much into project management. I've been in the space of supporting startups for the last 14 years, and yeah, especially to professionalize that space to where a startup can also be ISO certified, yeah. So I'm really excited to be speaking to people who are experts in their own lane, and I'm really humbled by that. So I'll just do brief intros for each of the team members that we have here, and then we'll also be discussing about which each of them will be like tackling in the space that we are talking about in the health sector. But I'll start with Wilson. Wilson, thank you so much for coming and honoring our invite. Wilson is from Clinic Masters, and also his specialty is in, let me just read that, software development and integration. Wilson, today you'll be discussing and talking about the importance of specialization in the medical industry. So you can gang up for that. But briefly, some more information about Wilson. He's the CEO and founder of Clinic Masters International. Clinic Masters is a software information management and medical billing software that automates patients' transactions in the clinic. So when you visit, it's like the doctor already has information about you and they know how to handle you because they have your history. It's also in 180 countries around East Africa. That's in Uganda, in Kenya, and also in Southern Sudan and Rwanda. Wilson has received the Microsoft Most Valuable Professional Award. Yeah, that's an MVP in a major of .NET programming. So he's a professional in that lane. For whatever has missed, you will be adding on to that. For Daniel, thank you for coming. Daniel is a CEO and founder of Teheka, yeah, a software engineer by profession. Teheka is a company that connects young mothers or first-time mothers or even parents, if they are fathers, yes, for home postnatal help. Like if you just gave birth and you just need someone to support you at home, they're really there to support you. So he'll be talking about how we can actually improve incentives for the nurses and what's there, especially now in this gig economy. Yeah, that's basically about Daniel. Edmund, thank you for coming. He's a communications officer with the World Health Organization. Edmund is a master in public health. Today he'll be talking to us about how we can improve our health sector and what is the role of World Health Organization in this, especially supporting the innovation hubs. Arnold, yes, he's a master in public administration. He's an actuarial science and financial mathematics graduate with experience in investment management and financial markets. Currently, he's the country program lead for the Mastercard Foundation under the micro, small, medium, and enterprises. So today, you will be talking about, you can actually just enlighten us some more. We have seen how much you guys have been doing in the ecosystem, trying to support us as innovation hubs. But then today we would want to hear more about the role of Mastercard in supporting health, yeah? What you're doing with the CDC and all. Maybe Esther, just want to find out if Alex is hearing us and is, yeah, okay. So Alex is from Impact Rooms and in the UK, and he's going to be talking about how we can leverage the different types of technology to improve health systems, and of course data privacy for patients. But more about him is that he's a venture partner, Global Leads, with the Impact Rooms. He's also a board member of the American Continental Health Alliance in Argentina. He's a blockchain expert in healthcare with the United Nations Economic Commission for Europe. He's a partner at Global Chain Ventures in Orlando, Florida. And he's an Adenian Labs board member. So members, please welcome the panel that we have today. And I'm really excited to be, here speaking with you guys. So we'll just go to a deep dive. I think I'll start with, I'll start with Daniel. Yes. Daniel, you're welcome. And we had said that we're going to talk about how we can improve incentives for nurses beyond the traditional methods that we've known. And what is your role in this, as at now? And please talk from that perspective. Thank you.
Thank you, Alan. So, as Alan said, my name is Daniel Ruyonga. I'm the CEO and co-founder of Teheka. Generally, Teheka, what we do is we help families find and connect with qualified nurses. And on a day-to-day, what that means for you out there is when you need someone to take care of your loved one, you don't have to go around looking for who's the nurse available, where can I find the nurse. You can just reach out to Teheka. Well, what that means for the nurses is they at least have an opportunity to get extra work for those who are employed and looking to join to the gig economy. And for those who are not employed, they have the opportunity to have where to work, and we also help them find the right opportunities. So in line with what has been put forward to me, how in terms to incentivize nurses, when I was approached to discuss the topic, I took the opportunity to invite some of our nurses and ask them the same question, because as you know, my background is in software engineering, but on a day-to-day, in the last 3 years since Teheka has been running, we have over a team of 150 nurses. So they were the right people to answer the question. So I'm here to pass out the kind of information they shared with me. And the most important thing that came up is there's no one solution that fits all of them. You have to understand which nurses or which health workers you're dealing with to identify the incentives that will benefit them. But as you said, they're the traditional one, definitely getting paid. So beyond getting paid is getting paid on time. They should be getting paid the amount of money that is equivalent to the work they're doing. So those are that was like the baseline. You can keep everything else, but get me paid for my work, get me paid on time. But of course, we talked further and we knew that beyond money, they're health workers. We know it's a noble profession. Most of them, they're in it for the heart and the good work they do there. So we asked, what are the other opportunities, what are the other motivations and incentives they're looking at? So top of the list was, show me the other opportunities beyond the traditional healthcare system. And we, being at Teheka, we're working at the intersection of the healthcare system with technology and healthcare. So they told us, I want to know that when I become a nurse or when I'm joining healthcare, I'm not just going to be stuck in the traditional healthcare sector. I can be able to step aside. I can be able to step in another sector, still doing healthcare, but also being able to offer my service. We probed further, and other opportunities came in, opportunities to advance their career. Now that I've gotten a diploma, I've gotten a certificate, how can, where I'm working today, be able to show me what are the career options for me? Do I get scholarships? Do I get funding to go and do maybe research projects on my own? Then moving forward from that, we talked about how did they get into nursing, how did they get motivated to become health workers. Most importantly was role models. They're looking forward who is in the healthcare that when I decide to step in there, I know this is a career path I can take, I can be like someone. Actually, one of the nurses literally said, I became a nurse because when I was young and I was in the hospital, I saw a female doctor putting on that white coat, and the name, Joanne, was the same name as her. So she had the same name as the doctor on her coat, and that motivated her. She didn't become a doctor, but she became a midwife down the road. So it was important for them to know that they're role models, and most of the nurses was telling, I became a nurse because I know someone who's a nurse. I was inspired by a relative, or inspired by a friend, and moving forward, they talked about awards. I would like to be recognized for my work, and giving me a certificate, let that certificate come with extra value. Maybe if I've been awarded as the best employee of the month, am I given one extra week off to rest and do some external project that I'm interested in? So we talked in line with a lot of other opportunities, being able to see work beyond Uganda. Can I be connected to external markets? Can I be able to move from being a nurse to another caliber, to another category of work? So beyond being just paid, they're looking forward to putting their best foot forward to get opportunities, to get paid for the work they're doing, paid on time, and also, most importantly, for the other nurses, for other people to join the community, they're looking for role models. So dearly, those are some of the things that the nurse shared with me.
Perfect. Thank you so much. We'll come back to you. I just would want to know from Wilson, if you could just enlighten us on the importance of specialization, yeah, in the medical industry. Yeah.
Okay, right. Thank you, Alan. Yeah, you introduced me very well. I don't have much to add. Yeah, maybe to clarify, Wilson Kutegeka is my name, CEO and founder at Clinic Massa International. And we develop software for hospitals and clinics. So all we do at Clinic Massa is work, customize, support Clinic Massa. We don't do any other thing, much as we are software developers, but our concentration is on e-health, basically. Like you said, yeah, we are in about 180 hospitals in Kampala, Uganda, Kenya, South Sudan, Rwanda, as well as Zambia. And our main goal at Clinic Massa is actually to reduce the waiting time for you or me when you go for treatment. Ideally, you shouldn't be spending a lot of time because you are sick. You should be treated quickly. And the clinician, your doctor, should have your latest update in terms of your diagnosis or your recent medication, that kind of thing. So that's our main goal at Clinic Massa. Regarding the issue of actual specialization, personally, I'm actually passionate when it comes to specialization. I strongly believe in doing one thing you are good at and do it very well. In software development or any major industries, you'll always hear the common saying, are you developing a system that is addressing the challenges at hand, the problem at hand, the need the community has? Now, if you are a specialist, you are likely to have more time to understand. You need to be like a user. You need to put yourself in position of the person who is having the challenges before actually you can think of a solution. And concentrating on one industry, as an example, gives you that opportunity and time to learn and understand. Now, when it comes to working out a solution, developing a solution, you are looking at working on something that addresses a challenge that you yourself kind of experience. Like you've rightfully said, I received an award from Microsoft many years ago, but usually that award is related to your professionalism in the field that they're looking at. And usually to get to a level of being a professional in a field mean you are not, you focus because usually natural as human beings we have a scope. You can't want to be there and know everything. If you want to know everything, you'll probably know none, in my opinion. So however, if you concentrate, you'll just become a master of what you are doing. So that's why I was also sharing earlier that much as we are a programmer, you can come maybe at Clinic Massa and you are looking for a solution in the banking industry. We will tell you no. but we also understand the cost, because usually if you say no to this or that or the other, definitely we need resources, we understand it is. So it's a cost, it's a challenge, but in the end, once you are known to be like Clinic Master, even our name is related to our product or our focus, you are known to be doing one thing, there is people, even your clients, will tend to trust you, believe you, but it takes time to reach that level, comes after some time. But however, if you are into so many things, then you are not properly defined. So that's why we strongly believe in specialization. You'll be able to output a product that addresses an actual need. Thank you.
Thank you so much, Wilson. I'll come back to you later. I have a bit of questions. So I'll just going back to Edmund. Thank you for being here with us. Could you please highlight more on how you guys are trying to improve the health sector from your side as World Health Organization? Press again.
Okay, this will do. Thank you so much, Alan. As earlier said, my name is Edmund Mwebembezi. I'm into public health and communications, and I work with the World Health Organization as the Public Information Officer. You have tackled a very vital issue for WHO, because one of the things that we stand for as an organization is to see improvement in all the countries, all the member states of the health sector, and this is through how they prevent disease, how they respond to disease, how they train health workers, how they build systems to support disease prevention and interventions. And yeah, so we, as an organization, we concentrate mainly on supporting governments, especially in different ways: capacity building, providing documentation and research for countries to improve their health sectors. And in the context of Uganda, we are supporting them. We are working with the Ministry of Health to see that the health sector is improved. Definitely it's a gradual process, so it's not something that happens in 2 days or 1 day or 1 year. But we are supporting in so many ways, especially training, supporting the ministry to train health workers in their skills, but also build more on skills. As you can see, of late we are dealing with an outbreak, COVID-19, and as much work as we have done, you realize that this disease came as a shocker to the public health sector globally, and not just Uganda. And it took us back to ground zero, where it required research and development, and the development was in terms of response, vaccines. As you have seen, so many companies in different countries have come up with vaccines, but also simple things like the SOPs. Initially, when the disease came around, no one knew how to go about it. It was similar to other diseases, but it kept mutating, so you wouldn't know what do we do to prevent Alan from contracting it from Edmund. And in the beginning, I remember we first talked about wearing masks, but there was no social distancing. Then we realized the physical distance is very important. Then we realized that even handshaking is a problem. So it's something that keeps changing. The environment keeps changing, and we have to really adjust. And in terms actually of research and providing information, I could mention antimicrobial resistance. I don't know if many of you know it, but it's one of the biggest problems that is actually coming up. Now, antimicrobial resistance is a kind of problem that the disease, when we overuse antibiotics, diseases mutate around that medicine. So you find that at some point, antibiotics cannot take care of an infection or anything. And so it's a multifaceted problem, because you find even in agriculture, we have to deal with it there, in the environment, in the clinic itself, even us ourselves. First of all, as a person, protect yourself from disease to avoid overly consuming these antibiotics. The plants that we eat, are they well cleaned? What pesticides are they using to protect these plants? All these things have created issues that need a lot of interventions, a lot of research, a lot of minds devoted to this. So WHO is really working around the clock to support governments, but in the context of Uganda, we also do training. It's very important that if we are going to improve the health sector, we have to build capacity. Building capacity of health workers, building capacity of the system. Systems keep evolving. So as he has spoken about innovation, there's a lot of innovation also going around. I also now, I can talk about improving accountability. One of the ways to mark progress, you have to have an accountability process or forum. How do you measure your success? How do you measure your failures? Because you cannot know if you're progressing or not without actually putting things in place to measure these kind of things. So these are among the many things that are being done by WHO to ensure that the health sector is improved. But one thing I need to point out that we always let the government take lead. All we do is come in and advise and say, what, according to research, this is what's happening now. Let's go in this direction. And that's why you see that, for example, in responses like COVID-19, Ebola, we are relied upon heavily for information, because our role is to ensure that we provide best practice in all these things, and to ensure that lives are protected on a larger scale. And maybe the other one thing I could point out is that mainstreaming health promotion. Health promotion is a wide aspect of health. It looks at the bigger numbers, but the intention of that is to prevent disease in the individuals. So you improve their livelihoods, improve cities, improve the systems, provide information, let people know, how do I acquire this disease, how do I actually treat it. But the whole point is to prevent that disease from occurring. So those are some of the things that we work on in summary to ensure that the health sector is improved. Thank you very much.
Thank you so much, Edmund. I'll come back to you. So I just don't want us to forget our online panelists. So Alex, you're welcome. Alan, could you kindly put him on the screen? Hi, Alex. Okay.
Hi, good morning.
Good morning. So thank you so much for being on time. I know it's maybe 1 a.m. in New York, but we're really glad to have you present. So you just briefly talk about yourself, and also one of the things I wanted you to really speak more about was how can we leverage the different types of technology to improve health systems in Uganda, or even across, for example, COVID is everywhere, or even the diseases that we have are not really, like particularly East African or anything like that. So you could broadly speak about that subject, and maybe data privacy for our patients. So you're welcome.
Thank you so much for having me. Indeed, it's 1 o'clock in the morning in New York City, but I'm happy to be in Kampala. And in terms of a little bit of just context, I wear many hats. I'm a physician by training, and I've been involved in technology integration in the clinical workflow for at least 20-some years. I'm an expert for healthcare and blockchain at the United Nations CFAC Commission. And what I do is I really help with healthcare systems design. And I've been working exclusively in Africa, I would say, in the last 3 years, simply because of the opportunity to really leapfrog from analog to decentralized digital. I think that the main problem when we talk about data management, and from that, the economics of healthcare in general, we really cannot separate between mental health, physical health, and financial health. So a lot of these solutions will and need to include all these aspects. And unfortunately, most of the ways that we look at healthcare, the whole idea of economic activity does not include patients and does not include healthcare professionals, but rather goes to the system. So data is not owned by the user. And I think that COVID has proven that this doesn't work. There's not only a lack of interoperability, there's a lack of intercooperability. And I think that many people don't realize that this is an economic gain, and that really what we need to look at is not just data privacy and data security, but also data sovereignty and who owns that data. And at the end of the day, I think that if we make sure that it is the user that uses that data and owns it, then afterwards from that can stem a whole economic activity. So what that looks like in just practical terms is that people can have on their phones an electronic health record that actually takes with them their personal information. So regardless to wherever hospital or whatever system they're using, it can plug in and go into whatever legacy system is in there. And in that, if you wish, Health Vault that it exists, there are different features that are able to give people or users, I would say, incentives or rewards, either for healthy behavior or for participation in surveys or clinical trials or things of that sort. So in that sense, I really think that for lean economies, and I always shine away from saying emerging economies or developing economies or third world economies. I'm not a fond of that type of description, but rather the difference between what we have in the US, UK, and Europe, obese economies. In Africa, where we have lean economies, really the way to go is to move towards a approach of data that is self-owned, and it brings direct monetary and non-monetary benefits for those who participate in it. So it's really about financial inclusion and being a health and wealth producer than just rather waiting for things to happen to you. So I'll be happy to elaborate as the conference goes on and we can talk about it. But at this point, suffice to say that I'm very excited to be here and to work in Africa and to make sure that the continent or East Africa or Uganda itself does not repeat by copy pasting, does not repeat the mistakes that have been done in the US, the UK, and Europe by simply just copy pasting these type of solutions and think that they would be helpful or useful in the context of your current health and economic state. Thank you.
Thank you so much for being here. You can now coffee up as we proceed with the session. You must be really tired. Yeah. So I'll go to Arnold. So Arnold, thank you for coming. And I know you guys have really been in this space. I have been one of the beneficiary hubs for what you guys are doing. But I would just want you to enlighten, the crowd on what Mastercard is doing to support the ecosystem, especially in the health part. I know when the support we have had from you guys in the past has been on really the COVID recovery, but you could talk more about the health part and what you're doing with CDC and, all the things that you're working on.
Yeah, thank you, Alan. Good morning to everyone online and here in the audience. I've already been introduced. Arnold Byarugaba is my name. I'm from the Mastercard Foundation, and I lead the micro, small, and medium enterprises. Actually, when I was looking at the crowd, the panelists here, I was feeling rather ashamed. Reason being, one, I'm probably the most unqualified person to be on the stage here. But I think more importantly also, I feel from a demographic perspective, we have 5 people on this panel. I think we should have had more women on this panel. If we have a population where 50% of us women, you know, that representation has to show in all aspects. So I think that's
Next
the other
year.
aspect, yeah.
Next year it's changing, and today I'm representing the 70%. So you guys just pretend you're 30.
Yeah, so I think I'll speak more about our work. Many of you have heard of MasterCard Foundation, and that's who I represent, the foundation. And our program, which is called Young Africa Works, which is a focus really around employment with a special focus on women, up to 70% creating, and the goal is we're trying to create 3 million work opportunities for young women in Uganda over the next 10 years. Now, what does it take to deliver some of these work opportunities? And that takes us to the subject here today. We quickly realized last year when COVID hit that you cannot talk about economic growth, you cannot talk about economic recovery if you don't have a healthy economy. I know the president kept on talking about this in his addresses, but I think for me that was probably the most powerful message that he was putting across. And what does that mean? For a long time, the health sector has been looked at as a responsibility of government, a responsibility of development organizations. But I think if I can also speak for majority of the people here, many of us over the last 2 years have learned a lot about health just because of this pandemic that we have gone through. And I think for me that is very encouraging. So in terms of our work, you know, we saw a paralysis across the continent last year from Q1. You know, the argument was, you know, we're going to get vaccines and everything will go back to normal. I think the other revelation that came out was that we quickly realized that there was inequity around that. Other economies were able to access vaccines. On the continent, we were not able. So as the foundation, we asked ourselves, you know, what do we do about this? And I think one of the things we continuously say is, how do you, and even at a very personal level, and I think this is a message for everyone, how do we ensure that we are continuously adaptive? Because if your goal is to create work opportunities and a pandemic is standing between you and that, what are you doing about that barrier? So we said we did engage, we did several COVID awareness campaigns last year into this year, you know, across the country through our various partners, but also we said, let's take it up a notch. And in July this year, when we realized that the vaccines were not coming through, you know, the continent, we had about 2% of people on the African continent who were vaccinated at the time. And African Union had given itself a goal of 60%. Now you can imagine moving from 2% to 60%. And the argument was, until we reach that point, we will not see the economic recovery we enjoyed in the past. So we said, okay, fine. What are some of the experts on the continent saying? You know, the likes of WHO, CDC, and we engaged them, and they set up a trust which was to put in place to ensure that they raise funds globally to vaccinate 400 million, at least of that 750. So as a foundation, we said, we also threw our hat in the ring, and we said, we will support up to 57 million of those vaccines. And that's a commitment we made. And hopefully, we believe probably next year when we are coming back here for Kampala Innovation Week, we should be smiling and talking about those 60% targets that we have on the continent. But I think for me, that is really what our contribution has, but it's also a reality of the facts. When you look at the Ugandan context, you know, when the pandemic hit, about 3 million households, you know, were put at risk. Essentially, their livelihood was put at risk. When you look at Uganda, we have about 8 million households. So that is almost 50%, close to 50%. So you imagine how many of those are not even tracked. But for me, such statistics are very concerning, and I think what I would appeal to us, and that's why our approach under Young Africa Works is a private sector-led approach, because health has to become a priority for the private sector as well. Because if we don't make it our priority, it affects us all because it's all our business. So I'll stop there, Alan, and hand it back to you. Thank you.
Okay, thank you so much for that submission. So I'll just go straight to Danny. Yeah. Danny, I know that you have quite a number of nurses that you're working with. And okay, recently the hot topic is on mental health, yeah? And I just wanted to find out what are the challenges you're finding with just even the workforce that you have, yeah, especially in mental health, because I'm thinking, so just maybe to give you a background. So I have 2 children, yeah, and when I had my first child, I had like what they call postnatal depression because I had laid in labor like for maybe more than 24 hours, yeah. So I didn't know what postnatal depression was. I really had no idea. So, and then when my child got out finally, okay, they had to be like in the nursery for like a month. So that's a month of every day you're in the hospital, and there's this nurse who tells you it's actually going to be okay, yeah? So there's someone assigned to you, and maybe later I had to, anyway, take the baby home, but we had to use like a catheter, yeah? Like you have to do the breast milk and then push it through the nose. So in that whole thing, it was just the nurses really supporting me, yeah? And then, okay, in that whole scenario, I found out that even the nurses have their own issues, yeah? But this is someone trying to tell you all the time, it's actually going to be okay, yeah? You know, it's like how you really put on makeup and things just need to look okay, and yet there's so much going on in your household, yeah? So I'm just wondering, like, how do you maintain those people, yeah? Like, how do you make sure that those guys don't lose themselves, even when they're trying to make other people feel good about their situation? Yeah, could just...
Thank you. Thank you, Alan. I'm no expert on mental health in any form, but when it comes to our nurses, because they're the people that we work with every day, they're the ones who advise us. For example, your situation, it's one of the reasons why we actually started Teheka. We know that it reaches a point and you just want to get out of the hospital and go back home. But when you go back home, most of the times you still have now the housework, you don't have someone supporting you in that aspect. The words that the nurses were telling you in the hospital, you now no longer have that person. Sometimes it's the conversations that you're having with people that help you go through situations. So when we started Teheka, one of our goals was to ensure that the support you get from the hospital with the qualified health worker comes with you into the home. And you also mentioned that, yes, the nurses also do have their own personal challenges. And one of the reasons that comes up is mostly the workload. And they actually stressed it a lot that sometimes there's too much work. You find, for example, if you work in one clinic, you're the only nurse there doing from A to Z of all the tasks in the clinic. So one advice they gave us is, depending on the needs of the client, can we always have at least 2 nurses working in shifts, or reduce the workload, give me enough rest, don't get me from one client to the other. Ideally, for them, it comes down to mostly having enough rest for themselves. We did ask, would you guys be interested in counseling services? Like after a situation, we know that some of the clients we pair our nurses with have a lot of needs, and they do have a toll on the mental health of the nurses. It's something they're open to, but top of the priority is, now that I'm done with working, I want to go home and have a good night rest, a good number of days resting. And I think we all know that sleep is one of those most important to mental health. So the things we're doing for our nurses, as I said, giving them time between work. We don't get a nurse from one client to the other without them having to rest. And for, as I said, some of the nurses are employed. We make sure that we work with them when they are having least amount of work on their hands. And then the other part is to ensure that we don't let the nurse spend too much time on one given client. What that means is, if a client needs a nurse for a period of a month, in that period we'll be able to have at least 2 nurses interchanging every 3 days. That way they get to put their minds to something else other than the patient they're taking care of. So those, ideally for us, it's in terms of reducing the workload, giving them enough rest, and importantly, having a big team to ensure that you, the client, because you requested for a nurse for a reason, you always have someone by your side. So those are some of the few things that we are doing at Teheka.
Thank you so much. Alex, we're back. So could you kindly put Alex back on the screen? Pardon? Okay. So Alex, I just wanted you to speak more about what you think the future of healthcare in the wake of technology looks like.
Could you repeat the end of the question? What do I think that?
What is the future of healthcare in the wake of technology look like today?
Yes. Thank you for that question. So I think that I think the future is bright. I think that COVID has been a very humbling experience around the world. Excuse me. And I think that we have realized that there are limitations to the way healthcare is designed in both obese and lean economies. I think that we have found that the engine behind healthcare is data and data sharing, and that we can only withstand these global challenges by not only sharing while respecting privacy and security, but also creating economic incentives so that the availability to solutions will be equal and equitable. I think that what people are starting to realize is that centralized technology, where data is not shared, has its limitations. That data, when it is concentrated with very few stakeholders, is attack vulnerable, it is collusion vulnerable, and it is censorship vulnerable. We have seen here, for example, in the United States, that there has not been a truthful report about COVID just for political gains. So one cannot think that we can treat or go through these type of pandemics without transparency. That is why we see here a lack of cooperation from the public in the public health measures, such as mask wearing or taking vaccination, despite the availability of vaccines in the US, in a way that I think is not equitable or equal for the rest of the world. These systems are, because they are collusion and censor vulnerable, it discourages the creation of innovation. So I think that if we start to apply technologies like artificial intelligence and machine learning, or what's called federated learning, which is more transparent and not a opaque box of using data. If we use technologies like blockchain or distributed ledger technology, which allows the data that is organized in blocks to be secure or encrypted, and would allow the participation of countries all around the world in the economic activity of knowledge sharing. I'll end by saying that I think that people think of healthcare as things, medicines, treatments, doctors, nurses, but they forget that this is a business and there's economic activity behind it. And really the only way to help it sustain and be helpful is to have financial inclusion of the users of it, just like we do with small and micro businesses. And I think that if we would borrow a lot with what we are doing and the innovation that is happening in Africa in the financial field, if we would do it in healthcare, where we use the equivalent of currency to the equivalence of data, I think that that wealth of information would translate to the benefit of the users. Thank you.
Thank you so much, Alex. I'll go to Wilson, or you guys will actually work together. So I would want to know from Wilson, how would you want a person like, or a foundation like MasterCard Foundation to support an entity like yours? Because these guys, they're big boys in the market, yeah? So.
Yeah, right. Health is big, and the need for system requires partners, different players. We know sometimes we think of health is in terms of medicine, doctor, lab test results, and clearly the component of data has also come out strongly, that actually treatment revolve around data, and that we put to good use this data if it's shared and shared on time. Now, so that means you, the patient, the staff at the hospital, the owners, we all need to be in an ecosystem where we can share data. Let me give an example. If I am sick now and I'm looking for treatment, I shouldn't be driving for about 2 hours or so. I reach at the hospital and I'm told the doctor you're looking for is not going to be around today. You need to come back tomorrow. I should have a model in which I find out, is the doctor going to be around at what time, and then I drive. Equally, if they take a sample from me to do a certain test, malaria, any test, and that test is not going to be ready maybe in the next 30 minutes, I should be able to go. I do what I'm doing. And if it's ready, I should be notified and told the time I should go and pick my results. To power that ecosystem, you require different players, including, for example, hosting the data, systems to transmit this data, etc. Now, you'll find, like I'm saying, different players. If there's infrastructure, there is soft skill software, there are people, etc. Now, companies like MasterCard, that's where they come in. You are building the infrastructure, the framework, the data center, the servers, the communication, name it. And then you have like companies, Teheka, Clinic, and others who are capturing this data and they want to share, and you participate on that same ecosystem, and in the end, when both the parties combine, you deliver the complete solution for the treatment, which I hinted on at the beginning. Yeah, thank you.
Okay, thank you. So in other words, these guys need to give you the money to develop, okay, you already have a framework, so you just need someone to support that, to grow it and scale it, right?
Thank you very much.
Okay,
that's right.
How much money do you need? Because I can actually ask them.
Oh.
You think about it.
We'll think about it, yeah.
And you'll go back and ask him. So thank you so much. Yeah, I think being in a place where we're supporting startups, okay, Hive supports entrepreneurs in areas of agri-technology, medtech, govtech, yeah, you know, in those areas. So I really understand what you're talking about, because in the past we've had a startup who needed blood to test something that they were, like a prototype. And we had to go to the Ministry of Health and actually ask them if they could give us the blood on their behalf to do the testing. And it works. So I know that you're doing a good thing, and you guys are like in the same league. So these guys are approachable. I can testify, yeah? So anytime you want money, you know where to pass, yeah. But thank you so much for being here to share with us. So I want to ask Edmund, what are you guys doing? Okay, right now there's so much misinformation online, and even people out there trying to concoct their own things. Yeah, I know that right now we don't have a master in anything, especially when it comes to COVID-19 and all these things. But I just wanted you to enlighten the people out there on what you're actually doing to stop the misinformation, like all the things that we'll be hearing from, background noise and all, and we sometimes take for truth, yeah.
Thank you so much, Alan. You've hinted on, I would say, something that shocked us as well. It was the level of misinformation around this pandemic. But what was even more shocking about human nature is how easily believable the misinformation was. Like on social media, they like calling them the WhatsApp aunties, the ones that forward, if it forward, and and those messages tend to go so far. It's very worrying, and yet there's a lot of credible information from credible sources to counter this misinformation. But you find that we tend to believe what's, I think, scary. I don't know, it's human nature, as compared to what the fact is, however uncomfortable it is. Well, so we saw what the infodemic did to the pandemic. So we had the pandemic, but we also had to counter an infodemic around that pandemic. The infodemic being that there's a lot of false information going around. So first and foremost, we sat down as the players evolved. We said, you know what, this is in our face, and unfortunately, the misinformation seems to have more players than actually the factual information. Because if Alan, you concoct a false message and then send it to Alex, when Alex forwards that message, he has become a player in that. And yet, I, as WHO or as an information officer, I have all the credible information on my website. I have credible information out there in documents. But to rush it is that we understood that we had an information issue going around for especially COVID-19. And one thing we did first of all was we worked with the Ministry of Health and got in touch with the main social platforms up to the highest level. We told them, look, we are dealing with a lot of information running around, and anyone can come up with information. Anyone can actually forge a WHO or ministry account and say it's from the ministry. We saw a lot of fake accounts going around, yeah. So these tech platforms said, you know what, let's help you here. We are verifying all your platforms. Send us all your platform names, send us the emails with people handling them, send us the website, everything. We're verifying. I think that's the quickest verifying system I've ever seen ever since I joined social media, because within, I think, 3 to 4 days, UNICEF, Ministry of Health, WHO, all had been verified. And then we say, you know what, now that we see there's a lot of information going around in WhatsApp, we created a bot, the WhatsApp bot, where the number was shared on on our platforms. That is the websites, the social media platforms. So how this bot worked is that you save the number, and once you save the number, it tells you, you type in maybe COVID-19, then it sends you instant information. What do you want to know? Prevention, spread, SOPs, what do you want to know? So once maybe you punch in number 1 for prevention, it breaks it down for you. In prevention, we have this, and this. What more do you want to know? So that was one of the ways that we innovated to see that we counter the information infodemic that was going around. The other thing is that we teamed up with I would call them social influencers. We understand their work, how effective their work is, because one, our accounts, people don't know the people behind them. But Alan's account, I know that this is Alan's account, and if I talk about something and I know Alan, if Alan talks about something and I know her, it's easy for me to actually to listen to Alan, yeah. So we got these people on board and say, look guys, we have an issue here and we want you guys to come on board, and we're going to provide the information that we want you to send out. Please help us, but where you're doubtful, where you're not sure, please revert to us, because then again, we don't want to deal with another misinformation from a source that we had taken on to help us with the information issue. The other thing was to make sure we send out as much information as possible, but credible and well-timed. Don't send too much information and budget to people's spaces, but also make sure that the information is available. If someone goes online and searches for something, let it be there. Let it not take you to a Google. Let not a Google source take you to other websites. Some have even paid to appear as the first websites on the Google search, or they have put up some information just to drive traffic to their website. We said, you know what, let's put out as much information as possible, and the more people come to access this information, they will understand that actually the facts are there and they can be accessed. And the other things that we did, we worked with the media. The media is a very, very, very key partner in the health sector. Let it be in health promotion, let it be in outbreaks like these ones. You cannot undermine the role of the media in such pandemics like COVID. And right from the start, we knew, man, the media is something we have to work with, and let's give them whatever information they need and make sure that they have the credible information that's needed, so that we don't create any gap that can be used to actually spread more misinformation and bring problems. So yeah, so it keeps evolving, but at least we've made sure that we tackle the key existing structures to ensure that at least we don't see gaps, and these gaps don't retaliate and affect our work. So yeah, so that's how we are working with the different players to ensure that we deal with this misinformation issue. Thank you.
Thank you so much.
Yeah.
So I'll go back to Arnold. Yeah, I just wanted, so you know, for me, I respect people that have money. Yeah, it's a natural thing. So we've seen everything that you're doing with vaccines and making sure that we get vaccinated. I am. And you know, these days, it's actually sad because, okay, you get vaccinated, but every time you're trying to get through the airport, everywhere, you still pay. And and even within 24 hours, okay, if you landed, let's say in Kigali, and you want to come back, the results that I actually got here will not even save me in the 24 hours. They will make me, you know, pay again for, you know, that. It's really sad, but that's okay. I think it's a system that we need to manage. So now for you, I know what you guys are doing right now, like you have told us. So I just wanted to maybe let the people know if there's anything you feel has been untapped into by, you know, the Ugandan ecosystem. You guys are giving us money, yeah? But are there things you think that, or maybe the micro, small, and medium enterprises that are not actually tapped into? These guys are in technology, in the technology space, yeah, but do you think there are other areas that are not being tapped into, and yet you guys have certain funds to actually finance them? Yeah.
Thank you, Alan. Yeah, I think to Edmund's point, I think you hear what the power of misinformation. Yeah, so for the record, you know, what we do is we call ourselves enablers. I think all of you here can testify to the fact that money alone can only take you as far. And for us, probably the biggest asset we have as a country is the will and the human capital. The question for us here is, what did you do with with those kind of assets, and where we see and that's where we see the opportunity. You know, when you look at innovators like Teheka, you know, what inspired him to head into that direction? When you look at, you know, Clinic Master as well, you know, what inspired them to think? And I think for me, it's a culture that we need to build in this country around empowering the youth to think about identifying problems, but more importantly, thinking about how we solve these problems. And really, that's the spirit behind what we're trying to create, because the moment you start to solve problems, you become an entrepreneur. And once you start to grow, for us, that's when we start to see the dividend, which is the work opportunities that come out of that process. So you asked a very good question, where do we see the opportunities? Precisely that is where we see the opportunities. When you look at, you mentioned the different sectors. You know, when you look at MSMEs in Uganda, they cut across all the sectors. But our focus today is on health. And when you look at the health sector, again, back to the point I raised earlier, who are the main players? You had a good example when you were trying to do something and you had to engage. Right now, government plays a very significant role. You know, for these innovators, things they're usually worried about is, if I come up with my innovation, who is going to protect me? Yeah. Number one. So intellectual property is a very big thing, and it's good to also know that we have a law now that caters for that. So gone are the days when those concerns that was a major concern. The other one is also around regulatory approval. Now, for the e-health solutions, probably you may not need, but for some of the people in the biomed, people who are coming up with, you know, rapid tests and the like, you know, these are some of the things that entrepreneurs need support on. So, but also all of that is working again back into an ecosystem. The other one is an obvious one, you know, for them to go to market, for them for the research and development, how do they confirm some of these assumptions they have made? They need some capital. So for us, the question is, how does that ecosystem function, and what role do we play? And going back to the point where I started, to be an enabler. The point Wilson raised around data. We know over the years there's been a lot of investment in data in the health sector, because that's how, you know, when we were growing up, we used to have this famous question in primary, 6 killer diseases. If you didn't know the 6 killer diseases, that was always the first question on SST. But when you look at, it was science. So when you look at now, you look at what is happening now, there's data that has been collected. All those people that have been vaccinated, their backgrounds, where are they? And it goes back to what Wilson was saying. How do we use that data to strengthen the sector, to build business models of that? You know, when you look at things like sales and distribution, things around, you know, health facilities that are being developed, some solutions that are being developed. So, and also, what do some actors like yourselves? I'll give you an example as Hive Collab. What expertise do you have as Hive Collab to support someone like Teheka? You know, vis-a-vis me, who is an ag tech, you may find you have probably more expertise in supporting ag techs as opposed to med techs, because of the obvious thing that it's a very specialized area. So how do we also build the expertise to understand some of the business models in the health sector and support some of these entrepreneurs? Some of the other issues also, we know it's a heavily subsidized sector. So the question is, how do we use very disruptive models that move away from the traditional approach that speak to our local context? You know, last week I was in a session, and there was an entrepreneur from a business called Healthy Entrepreneurs. And what they did was they decided to work with the existing health structures of the country. So we have what we call village health teams across the countries, or what some people call community health workers. Most of these people are volunteers. again, to the theme of today, when we say, how do we motivate, how do we encourage health workers? You know, the point that was brought around, what keeps them motivated, you know, to do this over and again. You know, sometimes role models may not exist. So what is that other aspect that you can add on? And I think for me, it's also the livelihoods. Because the moment you start to improve their livelihoods, and that's what Health Entrepreneur did, they partnered with these health workers and they become agents. So they use them, they become agents, so they have like a small pharmacy at a village level. And they sell drugs, so your basics, malaria, a few antibiotics here and there, painkillers, health products as well, mosquito nets maybe, and things like that that are used at a day-to-day. But also what that is doing for that entrepreneur at that level is that you're creating a network. You're creating a network of entrepreneurs at the village level. You're improving the livelihoods of some of these people at that grassroots. So I think for me, it's just how that ecosystem works at the different touch points, and our role really is around how do we create the rails for that to function well.
Perfect. Thank you so much. Just one more question that could be, before we go to the online audience, Esther and Jeff, I hope that you have some questions. But this is, I'm going to pose it to Daniel and Wilson. In the past, or not even just in the past, but even currently, in West Africa, there's a big issue of brain drain, yeah? So you will find that you have like all these highly qualified doctors or, you know, people in that space that just, you know, want to just stay in the UK or even just go there, yeah? Because that space really pays well, yeah, more than, you know, our Ugandan things. So I'm just wondering, is that something you have experienced in your space, or because you're coming from, you know, from the a tech, you know, background, and maybe you have established a niche in your area, it's not affecting you? Is it something that, do you have a problem with that? Have you had like a trek of your people, you know, leaving you at a point you really needed them the most because they think the UK is better, or, you know, they want to be in the US because things are better? Yeah.
Yes, right. We do experience it all the time. Might be not necessarily only to UK or US, even within, for better opportunities. And especially when you are starting up, you're starting, there is a lot of sacrifices. First, you are building systems in terms of how things are done. And especially if you don't have an investment, like, let me say from MasterCard, Arnold is here, and you are looking to earn, to be able to maintain your sales, but also grow capacity, then it becomes a little bit hard for you to have good resources to maintain a certain level of quality. So apart from the few committed people who see the vision ahead of today, they tend to last longer. But those who, someone is probably looking to come and work, they tend to look for opportunities elsewhere to be able to improve themselves. So people come and leave. In other words, the answer is yes, we experience it. Yeah, thank you.
Okay, so how are you staying afloat with that kind of challenge, and how would you really want the government out there to support you? Because we really want this space to grow, and we just think that sometimes maybe indeed, like, there's so much misinformation, we feel like maybe the government is not hearing very well from some, you know, maybe you could speak for them. Yeah.
Well, just to start on the first question, So for me, I'll tackle it on two ways. One on the side of our healthcare team that we keep recruiting to provide to our clients, and the other side as we as a company. On the side of the health workers, two ways. One is if they're leaving the country to go outside. Definitely it sounds bad, but you also have to look at it on the side of the health worker. What they come first, they are looking for opportunities for themselves. But when a health worker who's on our care team leaves to join another company, for us, it's a good thing. One of the opportunities that we put forward for health workers is you can come to HECA to build experience to get you to the job you're looking for. We know some health workers come straight from school, and they need to get experience, hands-on experience. So if it's a drain from the HECA care team to someone getting a better job, it's definitely a good thing, and it's one of the opportunities that we know we create for health workers. Then when it comes to us as a team, recently a number of like 2 team members left, and my team member was like, Dan, I think I'm tired of HECA being a training ground for other companies. Yeah. And that's something that happens a lot in a lot of startups here. You get these fresh, let's say, interns, you train them as soon as you get into the process to get them to start doing more than they could do at the beginning, they find other opportunities. And we as startups or businesses that are creating these, having these people, we should see it one way. One, it's a good thing, we're creating the right people. You're creating the next versions of you to start other businesses who will also create opportunities for other people. So ideally, you're promoting the ecosystem, but it doesn't mean that doesn't hurt your business. And how we are preventing against that is definitely there is no way we're preventing it. Even the CEO of the most paid company will leave to work to another company. But the way you can look at it is to maybe to give you comfort, or the way, instead of having 2 interns every year, make them 4, so that when 3 leave, you remain with 1. Next year, you have to keep doing that until to a point when you'll find some people who, as Wilson said, who will see beyond the opportunities they are going to create. They'll see beyond the payment, they'll see beyond the current challenges, and are willing to stay, to be with you, what you're doing, because they have seen the vision that you're selling to them, and you also bring them on board. But of course, as companies, we also have to ensure that we are providing this environment that shows people the bigger picture. We're not the people who are holding all the information. They don't see, they only do what you're telling them. They need to see the bigger picture. And in terms of sending the information on how to help, the government can help us, is programs like Youth to Work. I'm sure they're going to, next there'll be a number of people coming into the ecosystem willing to start working or looking for opportunities. Such programs create a lot of people we can have on our teams, or people can create other opportunities for other entrepreneurs. And then I'm sure there is, I think, a department for industrial training and all that in the government. When they get the people to do the training, where are they taking them? Can they have some of those people work with us? And in terms of brain drain, I think it's, depending on how you look at it, brain drain wouldn't be the word I would use personally. It's looking for opportunities to ensure that you can be able to better yourself and create opportunities for other people. If what is there today is not working for you, there's no point of you staying. So that's for me.
Thank you so much. I just want, we can go to our online audience before we close. Esther, do we have some? Okay, just give me a second. Okay.
Yes. Good morning, everyone.
Good morning.
Yeah, my name is Alan Ananura from iVenture Africa. We're a startup accelerator without walls. That means innovation and entrepreneurship promotion for us happens everywhere. We've been to refugee camps, we've been to schools, universities, corporate organizations, etc. I'm very passionate about innovation, but like the past 2 years have been hell for everyone. Ugandans have had our aunties that Arnold, WhatsApp aunties that Arnold referred to, who, will send you concoctions. They are innovating. I don't know where they learned that stuff from, but they are innovating one way or the other. When she crashes mululuzi somewhere and mixes jinga, I don't know. People have tried things because people were dying. And adversity is the mother of invention. It's good we have people from World Health. I'd like to pose this question. How do you involve local innovators? And I'm not just talking about innovators in these spaces. I'm talking about WhatsApp aunties. I'm talking about people out there. I'm talking about things like Covidex. It has been shown to have a level of efficacy against COVID, but the restrictions are terrible. The restrictions of entering health innovations are impossible, or next to impossible, because we see people who have made it. So maybe I'd like to hear from you how innovation has been put into consideration. You've protected us against false information, very good. But how have you empowered people to take care of themselves using their own means, where you can't reach them with vaccines, where you can't reach them with masks for a very long time? People didn't know about masks and so on. Yeah, that's it.
Thank you. Maybe I should ask, would you want me to say all the questions once and then you answer once, or one at a time? Okay, yes, please.
Thank you so much. I don't know if it was me you were referring to as Arnold for the WhatsApp aunties. My name is Edmund. Anyway, so you've brought up something very crucial around traditional medicines, and I'll tackle that first. Traditional medicines and these outbreaks that are engulfing us. Now, earlier during this 2-year period of the COVID-19, the Ministry of Health passed a policy on involving on use of traditional medicine to respond to such diseases. Previously, it was hard to regularize because obviously there's no research on how this medicine can be used, or there's even no research on the dosage. You could find someone telling you to drink maybe a jerry can the whole week, and you don't know how that can affect your liver or your body and other things. But with the passing of the policy on the involvement of traditional medicines in responding to these infections, it sought to regularize these traditional medicine practitioners to see how can they be involved in these responses. We can't always, because we came at a point when COVID had no cure at that time, and the vaccines were still scarce, especially for the African region, and yet people were dying. But also people were thinking hard and saying, you know what, this disease is similar to this, maybe we can deal with it using this. And that's how the professor came up with Covidex and all the other concoctions you saw on the WhatsApp, from the WhatsApp aunties. So the policy now protects but also empowers the traditional pharmacists, who can now approach the pharmacy division, the Ministry of Health, with their ideas. Say we have this, it has done this here and here. Obviously, before it's approved, it has to go through processes, the NDA and all that, because you cannot mass produce and recommend a medicine before you actually properly research it. And this actually cuts across even vaccines, even all these medicines that we get. They are first researched and approved, and before they are approved for mass production. So yes, there's a platform through the Ministry of Health Pharmaceutical Division to ensure that these traditional medicine practitioners are empowered and they are sought upon for their solutions, because some of them work. Covidex was reported to be very effective by the people who used it. So you can't downplay their role in promoting this. Then you spoke about innovation. The one thing I've seen that maybe innovators are not aware about, especially in health, is how much WHO is into innovation. Just to give you an example, in 2019, at the height of the Ebola outbreak in DRC, bordering Uganda, the area in which the infections were highest was so close to the border. And we had a doctor, I think he's even on the COVID response team at the highest level. He came up with a rapid diagnostic system for Ebola patients. And this is called Dr. Misashi. And this was recognized as a very good and trailblazing innovation to improve turnaround time, because the lab is very crucial when you are dealing with diseases. You could get all the patients in, and then before you treat them, you need the lab to confirm what you're treating. That delay there can lead to death or delayed responses, so many things. So he came up with this innovation where you could rapidly and have a turnaround time of results, I think, within a day. And this really was a good innovation and was recognized by WHO in the African region. And I think he was supported to even improve it further. And this is something now that is going yearly. There are teams that have been set up to recognize innovators, especially in health, because we are primarily a health organization in the UN. And they are given, there's always an announcement calling on innovators to submit their innovations or their prototypes or what, and these are assessed by teams at the higher level in the regional office. And the best 3 are usually recognized and then supported to build their systems further. And it's good that now, at least on behalf of the organization, I'm in touch with the innovation startup. So I think it will be a good way to work together and empower them to empower other innovators through them to come to us and, talk to us and see how they can be supported on a global scale, maybe regional scale, even the country scale. So yeah, so you shouldn't be worried. I think all you should do is to ensure that reach out, knock on these doors, because you never know. I am a contact person for the public when it comes to the office, so it's easy for me. You can reach out to me, and I'll always advise you, do this, and you can always be supported. I don't know if I've answered all your questions. I hadn't written them down, unfortunately. Thank you very much.
I'm sure he'll look for you.
Yeah.
Thank you so much. So we just have a very short time, just 5 minutes, but I thought we could just answer a bit of questions from the audience. So Arnold, you can please go ahead and answer some of the questions I've shared with you.
Okay, so the 2 questions. One is around, what are we doing for startups in the health sector? And I think that I already touched on to a large extent. I think what I would probably focus on is, health as a sector for us is one that is relatively new, but also is very strategic in nature. So you will see us getting more involved in the health sector and supporting and working closely with startups in that space. We currently have a few partners on the market that we are working with, and we will increase the number of hubs we are working with. The goal is really to support the Startup Uganda ecosystem that is a touch point for a lot of these entrepreneurs, and going beyond that. So yes, so you will definitely hear more around that. So I'll leave that one there.
Yeah.
The other one is around the aspect of, yes, it's one thing to create jobs, but do these jobs at least meet minimum wage?
Yeah.
And what's our role in all of this? So that's a very good point. I think one of the things we have also realized is because our approach is a private sector approach, it's not enough to go to government and say, policy is not going to address the minimum wage challenge. The economy the private sector has to respond first. And then what government would do is to regularize or from a policy perspective, to ensure that certain aspects of that are being protected in terms of the workers. So our approach is, if you have more if you look at our economy, about 80% in terms of the number of businesses are micro and small medium enterprises. So for us, that is where the focus should be. How do we empower more of the micro businesses to become small businesses? How do you empower more of the small businesses to become medium businesses? Because the more you do that, the more those businesses grow and the more they can afford to pay employees more. Teka raised a very good point that was around how do you allow them to be part of the vision? One of the other things we're also empowering a lot of these entrepreneurs as well is don't think of your employees in the traditional sense, a salary. There are different ways you can reward them. There are different rewarding models where a person can get a certain pay, but you can reward them through commissions. You can reward them through stock options. In the event when you raise funding, you get an equity investor. So they know they have skin in the game. I'm committing to this, but this is where we're heading as an organization. So I think there are different ways of addressing the minimum wage. But I think the first thing is that the businesses have to first survive. The businesses have to first grow for you to push a narrative around increasing the wages. So I'll leave it there. But yes, it's a priority for us, and it's something we are fully aware of and are championing as well.
Okay, thank you. So last question, this question goes out to Clinic Masters and Teheka. It's about inclusivity. One of the people in the audience says, it seems you guys focus on urban areas, yeah? Because, this is a tech industry, and most people really in the rural areas who will really want to assist are not really like tech savvy. So he's just asking, what are you doing to make sure that they are, brought on board? Yes. Just 1 minute.
Yeah, so to answer that question shortly is you can't start by helping everyone. You have to start somewhere, and then you can grow beyond as you can reach more people as your business grows. That's ideally for me the short answer. Of course, we would want to help everyone, but when you're still surviving on a day-to-day, or you're having a team of 3 people, 5, you don't expect to be helping everyone who's in need of your solution in Uganda. So shortly is today we may be only in urban areas because that's what we can manage to serve, but the goal is to grow and reach many more places.
Thank you. So I just want to thank you, gentlemen, for coming here to share yourselves with everybody else. Alex, are you still online? Do you want to say something before we close?
Yes. Thank you so much for this opportunity. It's been a lively discussion. I just want to plug in that anybody who wants to reach out to us, we train and incubate and accelerate startups at Adanian Labs based in Nairobi virtually, as well as in Latin America through ACHA. And of course, we fund or connect these startups to the right type of capital at Impact Rooms, which is the global Pan-African fund. So the whole conversation here is propos. And I would like to just end by saying that really we need to rethink the way we do everything, that this is like a triangle between emerging technologies, emerging markets, and emerging business models. And if we continue just to copy paste and do what we are doing, then we will see no results any different in COVID 20, 21, and 22. So I urge everyone to really think of how to redesign, not do a B2B play, but do a direct to consumer play using peer-to-peer network technologies, which actually will help translate the wealth of Africa to the wealth of Africans, transform people from being healthcare service users to health and wealth producers. Thank you very much for this opportunity.
Thank you, Alex. Your last remarks, Arnold, in 5 seconds.
I think I've said a lot today. I mean, mine is really just to thank Hive Collab for the invitation. I think to the audience, those online as well. I think my parting words will really be around the fact that, health is everyone's business. So I'll just leave it there.
Thank you so much. As a parting shot, maybe is to encourage the innovators to actually reach out to these entities. You just never know what door you could open, and don't look at the high-rise buildings and you think maybe I can't knock here with my innovation. Reach out, maybe you could be guided, you could be shown the way, or you could be supported. Thank you so much.
Thank you. Daniel.
Thank you, Alan, and thank you for the invitation. My last words would be in terms of identifying opportunities. For most startups, it's important to realize that startups are the intersections of different sectors: health and technology, health and transport, technology and environment. That's where the next opportunities are most likely to be for most startups and businesses. So, yeah.
Okay, thank you, Alan. Thank you, everyone. It has been great today. Yeah, my last word, we believe in partnership. We believe in working as a team. So if you are out there, we might be in the same industry, but we strongly believe if we partner, we become better than working individually. So let's collaborate. Thank you.
Thank you so much, gentlemen. We're really honored to host you this morning. And yeah, have a good day. We'll meet again very soon.
Thank you, Alan. So you mentioned that you're representing the 70%. I haven't had your last remarks in regard to this session.
Wow. Okay, so I kept hearing about the aunties and uncles. What do they call them? WhatsApp aunties and uncles. So I am just one of those startups that have been concocting, okay, I really concocted, I don't want to call it concoction because people just, they would not understand my formula. So I came up with a formula of creating an antibiotic for my household, yeah? So it takes 2 months to make, and I make it in my house, and it has really been working for me for like 3 years. So that is for me, yes. I'm really representing the health sector in my house, yeah? And I think it's just because I work with really startups. But I'm really honored to be here to share your minds. It's really interesting, and thank you for having us.
All right.
Yeah.
Thank you very much, Alan, and your panel. Gentlemen, you may please take your seats. Thank you, Alan, for hosting this very informative panel. I think key lessons were that a lot is happening in the health sector in Uganda, but then there is also hope that there are people that are innovating around bringing disruptive solutions, you know. I like that Alex mentioned that we need to be very open to introducing new technologies, because if we do not, there is nothing that is going to happen differently. I also like that the panel was very diverse. We had people answering to, you know, postnatal depression and how they are meeting that need for various women. I also like that we had key people from different sectors representing and speaking about what they're doing in the health sector. I would have loved to see a person from, you know, the government, because right now health is a very hot topic, especially now that the pandemic has alleviated some of the things that we've been doing wrongly, misinformation being one of them, and how the government entities hope to counter that. So I will not waste as much time. The next panel has already been waiting for over 20 minutes. I will do the honors of inviting Alan Lule from Makerere Innovation and Incubation Center. He's going to be moderating a panel that will be talking about creating opportunities for profit with an impact-based business. This is a session that I'm looking forward to attending, because yes, how do you create opportunities for profit with an impact-based business? Thank you very much. If you're interested in interacting with any of the speakers that were here before, they are in the room. Meet them, network, make sure that you're very intentional in grabbing those opportunities. At least that is what Daniel No. That is what Edmond said. You have to be very intentional in grabbing the opportunities. Don't look at maybe the World Health Organization as a very big structure. Enter in there, disrupt, introduce new ideas so that you're taken in. So at this point, I will welcome Alan Lule from Makerere Innovation and Incubation Center to take over this session. Thank you.
Great. Yes, thank you so much. And good morning to everyone, viewers online, and of course at the Design Hub Kampala physically. Yes, I'd like to welcome everyone to the Kampala Innovation Week. And for those of us who are joining in for the first time, my name is Alan Lule from the Makerere Innovation and Incubation Center, which happens to be among the members of Startup Uganda. So the Kampala Innovation Week is basically an ecosystem event, getting us together to, of course, appreciate and, of course, to define more ways of how we can really keep on pushing and reinforcing impact as we know it, mostly for the theme of today's Kampala Innovation Week. So joining me on call today is Jeff Steinberg. Jeff, good morning and welcome. I know you are in the US at the moment, but you are just live at the Kampala Innovation Week at Design Hub and, of course, virtually online. Jeff, you're welcome.
Good morning. Thanks for having me. It's great to be here.
All right. Good to see you, Jeff. So, Jeff, before we get going, just to remind the audience that this is one of those sessions and conversations for the Kampala Innovation Week, where we're basically going to explore a couple of opportunities which have been posed by the food value chains. But of course, in this case, we're looking at profit with impact-based businesses. And just to, of course, re-echo for the audience is that this is one of the kind. Jeff, being a founder of Latitude Trading Company, commonly known as the maker of Latitude Chocolate, yes, in Kampala. Yeah, so for those of you who have passed around Acacia in Uganda and Kampala, you've, of course, may have come around Latitude Chocolate. Yeah, I know it's quite interesting to enjoy some of those products from Jeff and company. So Jeff, just before we get going, just a brief intro from your side as well. I'd like to basically know briefly who is Jeff and what is Latitude Chocolate and why Latitude and of course why Uganda? Because I know that gets us going from the word go. Why exactly are we looking at these opportunities coming out of these impact-based businesses, just like of yours and of course now? You're welcome.
Thanks, Alan, for that. Our experience with you of specialty cocoa and bean to bar chocolate income. And the goal of our company, the mission really is to improve the livelihoods and incomes of smallholder farm impact evaluation in the social sector. So working with nonprofits from the social sector, and then having seen that Uganda is a beautiful, but not a lot of kind of impactful. 2017 with a small team, myself and a few others out in Western Uganda, really a small that in supporting farmers and buying cocoa and figuring out how to produce a quality product. And so we started in that first year with about 200 farmers. We're now up to about 2,500 certified organic smallholder farmers that supply our kilo and every farmer who comes to deliver to our company. And so, really what we were looking at is, a couple of things. One, how can we capitalize with social impact or with transparency or with some sort of relationship at play? And then secondly, how can we add more value in country, create more jobs, and kind of push things forward such that, we as a producing country of a raw material, and traditionally cocoa, cotton, coffee being, colonial, finished product, whose price doesn't really fluctuate very much, whose demand is pretty solid, and that kind of allows us to then, stabilize what we can pay to farmers, to offer them, a better deal than we otherwise would be able to. And so that's the sort of genesis behind what we built over the past couple of years, and all of it, from an entrepreneurship standpoint and from an innovation standpoint, all of it is built on the backs of experimentation, trial and error, and just learning as we go, and figuring things out as quickly and as cheaply as possible.
Yes, sure. Thank you so much, Jeff. Yes, for that brief, warming introduction. And I'm sure by now everyone knows that. Yes, so Jeff,
examples.
Sure. This is like yours, which they pose for our ecosystem, because right from what you may call an impact-based economy, I'm sure right now agriculture really stands at the helm of the pyramid to pose enough opportunities in there. And just to get right on point, please just help me elaborate to the viewers online, what does it really take, first of all, to deal with the food value chain? For example, I know you are dealing in cocoa, maybe even coffee, as being one of the complements for the products that you really offer. So just first of all, help us understand what is the linear curve and the value chain of a business like Latitude Chocolate, and probably just on the high level elaborate what opportunities are in there, because I know right now you are doing branding, you're doing marketing, and of course payment processing. But then just help us understand for an ecosystem, where does this come from, and probably what opportunities in there?
Yeah, it's a good question. So as a company, Latitude, we're fully vertically integrated. We source directly, from the farmers. We do primary processing, and we take everything from the raw material to the finished chocolate bar. That is a lot. There's a lot in there, and so what I would focus on in terms of looking at, what it takes to do that is a really good team and a lot of grit and hard work. But it's I think there's a lot of opportunities at different points along the way. Definitely at the source and at the farm level, I think there's a lot of great people working on how do we, collect better data? How do we get farmers more professionalized and growers and producers more professionalized in terms of skilling with businesses, banking, and kind of other resources that we can bring to the table. And so I think that is still a tremendous opportunity, as much as there's a lot of people working on things like, blockchain traceability and, ecosystems that farmers can plug into for inputs or for financial services. I think there's still a tremendous amount of work to be done there, just given how many people throughout the country and throughout the region are reliant on, agriculture for their incomes, whether it's, just food for the family or whether it's a cash crop. And so I think that first point of contact is really a tremendous opportunity for further development. Further on down, the supply chain, we ourselves have invested a lot and see a great opportunity in the kind of relationship building and the traceability of the supply chain. And so being able to build that complete story, introducing a farmer to a final customer across the world and bridging that gap through technology, through relationship building, through data is really, another opportunity, which I think kind of goes together with that, first farmer issue. Next, I would say, obviously, there's a tremendous room for growth in terms of manufacturing and value addition on the raw materials. I think, a lot of investment is happening already in obviously the coffee sector, dried fruit sectors. And so I think, it continues to be some good strategic, opportunities there. And the last thing, which I'm, very interested in, and not just within Uganda and East Africa, but around the world, is thinking about that kind of last connection between, a producer or a manufacturer and the consumer of the good. And I think this is one of those areas which is a little bit, I don't know how I say, underrepresented or underacknowledged in terms of the challenge that it presents and the number of linkages that are there. So we all know the big companies that are producing many of the products that we find in the supermarkets, but what we don't know and we don't acknowledge is the importance and the margin and the challenge of working with the folks in between those manufacturers and in between and the company that presents it to the consumer. So the distributors or the folks who bring that product to market. And so I think that is a really, I think that is an area which is really ripe for innovation in terms of thinking about how do we more efficiently and more equitably get products from producers and manufacturers into the hands of folks who are actually consuming the product. It's a really key thing that, needs great innovation and great minds to get behind, for sure.
Yes, sure. Yes, sorry. Thank you so much, Jeff. That was pretty elaborate. Yes, I'm sure our colleagues online are basically trying to now identify opportunities. And of course, I know, Jeff, you have impacted over 2,600 farmers, well known at least for having established part of your initial identification opportunities in agriculture with the Gulu Development Center in Agriculture and many others out there. So right about now, I really want to get to know or hear from you. Right now, we have over 10,000 of graduates leaving university every other time. And of course, these are composed of job seekers, these are composed of innovators and entrepreneurs. And of course, coming from the background of innovation, and of course, working hand in hand with Makerere University and the Ministry of Finance to really see how we could also offer alternatives to employment. I see a couple of talent coming out of university. These are innovators, these are entrepreneurs. So I'm just keen to understand, in terms of seeking and of course identifying opportunities, you being in value addition, what would really be your key stake in terms of the key pointers that at least a graduate who is innovating or who is trying to set up something could at least be able to chip in into the value addition? Because right about now, I know at least beyond you just exporting coffee and probably cocoa, you also add some value to what you sell in Kampala and probably even in Kenya. So what can an entrepreneur look into any food value chain outside there, beyond even luxury chocolate, to see how they could probably leverage on the digital aspect? Because I'm talking about right now applications, I'm seeing systems being developed to complement such a sector. So what would be your really key traits of that entrepreneur who's just trying to at least get into the aspect of digital to complement the food value chains in there?
Yeah, definitely. I think the most important trait, and I think what is inherent in the term innovation and entrepreneurship, is ability to learn and adapt. And so for those folks who are coming out of university and interested to get involved, not just in value addition and in kind of the digital space, but really any professional space coming out of university, the first thing that you need to be focused on really is, how do I learn and how do I learn how to learn, basically. Let's efficiently gather the knowledge that I need in order to solve a problem or figure out how to test something or how to fail so that I can find the right path as quickly and as efficiently as possible. And so that's kind of my number one advice that I give to every entrepreneur, every early professional who's coming out of university. And I think, looking at sort of digital trends and digital opportunities in this kind of space, I mean, that's just key. It has been for so long, the status quo has been in place. Our food supply chains and our ways of getting products to market have been the same for quite a while. You go down to the corner store and you buy it from the corner store, and that corner store gets it from a distributor who gets it from a manufacturer who gets it, right? And this whole thing has been organized that way for a long time, which means that if you're coming in as an innovator or as somebody new, you got to totally, try and rethink things and think outside the box and try some crazy ideas and fail and sort of figure it out. And the key really to entrepreneurship is how efficiently can you learn before you run out of money or you run out of runway. So that's definitely the number one thing I would say.
Absolutely. That has been clearly noted, Jeff, and I think it really makes so much sense because at least the ability to really learn and be flexible and to course adapt is the first trait at least to really get in there. So that makes so much sense to me. And so, Jeff, coming straight forward, just to add on to that, I know right now it's a bit difficult as well for those young innovators, even startups in our ecosystem, to really thrive due to a couple of really, I would say, requirements. It could be infrastructure, it could be talent, which at least they can really match up to develop something that is really market fit. So I want to also understand from your perspective, in addition to just learning alone, in the digital space, there's a lot of validation required for your product to really be market ready. And of course, one of the, at least I would say, leverages, and I'm thinking right now, as of course being opportunities in this case, would be the ability to co-create with already existing companies. So how possible it is, and exactly how can really innovators, entrepreneurs, and of course startups really leverage on partnerships with companies like yours in the food value chain sector, see how they could co-create, test out these products at the infant stages, at least to achieve the mileage of whether they can know this is really market fit. Because much as we have seen a lot of big solutions in the agriculture sector, I really feel like we haven't really done enough. And of course, there's so much room for space to at least innovate within there. But then how do we now really co-create in terms of developing partnerships with already existing companies that at least have been around for some time, in that they could at least offer some additional knowledge for us to really establish our innovations in that case?
Yeah, definitely. First and foremost, obviously, there's a number of kind of innovation labs and collaborative groups around Kampala. So I think that's definitely the first stop in terms of, understanding whether your product makes sense, whether your idea has legs, and trying to figure out and validate the initial stages of building a product. Definitely, without question, most entrepreneurs have been in your position at some point. If somebody is even a CEO of a business who's not a founder, at some point they were learning and they were trying to figure out an industry. And so I encourage, someone who's building a new technology or who wants to build the technology to reach out to leaders or to folks in the industry in which you're operating and just ask for a quick conversation to discuss ideas and to understand from their perspective, what are their challenges, what are some of the issues that they face, and what do they think of the idea that you have. And if you may get some tough feedback, you may get some great feedback, you may get some ideas, but that sort of kind of endless enthusiasm and conversation, I think, is really important in terms of understanding, not just whether your idea has legs, but, whether it's feasible and whether it will be of value to somebody. Further on down the line, we have just come out of this kind of a scenario with another startup in Kampala called Metajua. We worked together with them to build a digital traceability system for our cocoa farmers, basically to adapt an existing system that they had. And so we went through that process with them, understanding that, they knew what our pain points were and they knew about our company and what sorts of challenges we would face. And so I think if you're that company who's coming in and trying to get buy-in from a potential customer, a potential user to test your product or to help you develop it, really what you have to do is make sure that company and that person understands the value for them and for their business, and then as well try and make it as seamless and painless as possible for them to get you the information that you need to move forward. Okay, and so you as a developer or as an entrepreneur have a set of questions that you need answered to help you move forward with your business or to help you move forward with your idea, and those need to be very concise and clear. And when you come for a chat with the leader, or when you come to a company that you want to partner with to develop your technology, those questions need to be very clear, and you need to know how exactly you're going to get to the answers that can lead you to the next step. And that next step could be going backwards and rethinking your idea, or it could just be going in a different direction. But the bottom line is that kind of clarity, about what you don't know is really crucial in kind of having these conversations. But I will definitely say I regularly get, and I think many entrepreneurs that I know in Kampala regularly get emails and requests from folks who are thinking about ideas and thinking about technologies. And definitely we're always excited to spend 10 or 30 minutes just chatting and helping somebody think through their idea, especially if it's pertinent to our sector or something that we're also interested to work on. So I think don't be shy and definitely reach out.
Yes, sure. Yes, I think that really makes so much sense, Jeff, because I really feel like at times that urge to really reach out, ask for this information, ask for the communication, I think is something that is really key, which I think now is the role of really innovation hubs and the enterprise support organizations to really see how we could really develop the capacity of these entrepreneurs to at least be able to reach out confidently, express themselves, and of course, onboard a partner, just like you. So I really feel like it's all about the altitude engagement framework. How do you really present in the simplest way possible, whatever you have to present, at least to leverage on my company, just like you. The other ways, the only challenge I just see in there at times is, at times there's so much of a long turnaround time, which of course tends to demotivate these entrepreneurs. And of course, in there is too much frustration. But nevertheless, I think it's just at least one thing to give a shot to see how entrepreneurs can really get moving.
Yeah.
Yes. So Jeff, coming now back to profit in this case, I know there's opportunities in there, but then I want to really also understand how valuable are they really in there. So I can just give us a scenario right now. We saw a lot of opportunities coming up during the COVID crisis, which was so much posed with last mile distribution and of course the supply chains, which of course, as we know, almost everything went digital due to limited movements. And of course, I must say, we have never gone back. I can just see opportunities springing up every now and then. So just help me understand which opportunities has Latitude really posed through last mile distribution, mostly around the digital economy, and exactly how is this impacting the status quo of the people in Kampala?
Mm-hmm. Yeah, from Latitude's perspective, I mean, much of our business is split into kind of two directions. One is B2B, so we supply raw cocoa beans to chocolate makers around the world, in the US, Europe, and Japan. And then the other part of our business is producing chocolate bars and selling them directly to consumers. And so in this kind of COVID world, it was the first part of our business, the B2B, I think it was pretty natural, this kind of movement to, I guess, more digital representation of our work and communication of what we do to our customers. And so the kind of digital supply chain traceability, the ability to tell stories and to present materials to customers who can no longer interact in person, can no longer come to Uganda to interview farmers was really key for us. And that's kind of something that a direction that we're always moving in anyway. So the COVID push was kind of in that direction for us. On the side of the consumer and that kind of, I guess, last mile distribution and, everything that's going on in Kampala, we were stuck like many businesses were, having lost a lot of walking customers and lost a lot of, interest and excitement by people seeing the chocolate making process. And so, we tried as much as possible to capitalize on, the Safe Bodas, the Jumias, the Globos in terms of getting product to people and getting it in their hands with different promotions, which is really key. But I think one thing that, in a similar way that we're doing with our B2B, for our chocolate side of our business, we're really focusing on trying to figure out how to best communicate the story of the product directly to consumers through social media, through our website, and through our packaging, like getting the story in front of people when you cannot be there to explain it to them or to sell them on the product is a really tricky thing. And so I think, as much as possible, capitalizing on that, social media storytelling is really key. In terms of other things that are going on and developing, I think, there's still a good amount of space to kind of perfect and improve on the delivery of food and grocery and items and the exchange of items kind of remotely across the city and across cities. And as well in terms of payments, I think we still have a little bit of ways to go in terms of the smoothness with which we can process orders and payments across all kinds of businesses, not just Latitude. And so that's something that we're working on and trying to figure out. Particularly in the U.S. for us, we have set up a website and in the process of arranging a 3PL basically to remotely, without any office in the U.S., get orders online, get orders through social media, and have them dispatched by a warehouse that just receives an order from the website, gets directed where to send it, and it gets sent out. And Latitude has no presence, has no registration, no staff, nothing in the US. But putting that kind of a thing together, is really an interesting opportunity for a company like ours, especially when you look at other markets, not just the US, but, Europe, Asia, even Nairobi has a potential to have that kind of situation set up. And just the reason why that's important for us is because it's the direct connection to the consumer. We pay a fulfillment agency, we pay a warehouse or something like that, but essentially we're D2C there, which means we get a better margin for the product. We don't have to pay brokers, distributors, middlemen. For a producer or a manufacturer.
Sure. Yes, I think that really makes so much sense. Because I normally believe that nowadays the power really lies in the mode of engagement, and of course that normally defines the traits for a business to really grow. Yes, so Jeff, coming still just into profitability of such a business which is so much impact based. I understand the process of growing a company from my experience and from what I've seen other companies. At times it's so hard to grow, to become profitable, unless probably you achieve scale. Maybe say we're talking about more outlets, we're talking about more employees, talk about all that. But then, much as I know you are set up in Kampala, I'm very sure one of your dreams could be, of course, scaling across the whole of Uganda. So much as we're talking about Kampala, I'm seeing so much impact based for Gulu, for Mbarara, for Jinja, name them across the entire country. So I just want to understand from you, what can be the turnaround time for that at least profitability to come in for your company, especially that you are trying to become profitable at the same time scaling the company? I know that's pretty hard, but then how long do you think approximately it can really take for you to become profitable as a company, having, of course, at hand all those other priorities to really look at that time?
So we started in 2017. For the first few years, we were mainly producing and exporting specialty cocoa for the craft chocolate market around the world. And so when we built this newest chocolate factory in Kampala, we opened February 2020. We had already had some chocolate products in the marketplace, but that whole factory and setup was brand new, and we were still even learning how to use new types of machines. And so within, I would say, 3 years, the cocoa side of our business was profitable while paying 15 to 20% premiums to the farmers compared to the market rates. We built the factory, and obviously COVID was a little bit of a setback, but we're actually even quite close in the first year to the entire business turning the corner this past year. Every year we've basically doubled in size, however you want to look at it. And so this current financial year that we're in, we're projecting definitely it will be profitable. And so that's basically, let's say for about 4 years or so, 4 or 5 years. Within that, basically 2 businesses within 4 years. Because we look at the chocolate manufacturing, the cocoa, as much as they're under the same roof, they operate as independent businesses. So yeah, it's tough, and like you said, a lot of it's about scale, and that's just been our main focus for the past couple of years. The first years, you're always thinking about how do you produce the right product, how do you produce it well, how do you replicate it, and that is your main focus: getting it right, building a reputation for yourself, building a name. And after that, everything shifts to, okay, how do I take that model and scale it as quickly as possible while maintaining the kind of integrity of what you're doing, the integrity of the product. And so we've been really lucky with the team that we have, across the country in Western Uganda and Kampala, to be able to scale quite quickly, from just 200 or 300 farmers to now over 2,500. By September next year, we should be at 5,000 certified organic farmers. And so I think, once you get over that hump, from there, it's kind of like liftoff, and it becomes a little bit easier to put the building blocks together.
Yes, sure, Jeff. I think I hear you there when we talk about really some good time required for a company to really become profitable. Because I understand, like you said, you have to really, first of all, achieve the market fit, which quite so much makes sense to me. Yes, so Jeff, just to add on to that, I know scaling comes hand in hand with funding, of course, an investment into the company to see how you could, of course, employ more people, try to scale your products with more outlets. And I know that's now something which everyone from the side of the investor is now looking at this company. Is it really investment ready? And if then, can they become profitable at the end of the day? Mm-hmm. So I just want to understand, among the strategies you've been putting in place for now, just beyond, of course, the projections, and of course, beyond just trying to go around all regions, setting up Latitude, I want to understand what would be your key ideas, what would be your key strategies that at least you would think that any entrepreneur out there, be it serial or not, would really take at least into focus as they look out for funding to scale and become profitable at the end of the day.
I think the key to raising that capital to help you scale is really it's 2 things. It's one, your product. Have you legitimately and substantially proven that it's of value to someone and that it can work in the marketplace. And then the second thing, obviously you need your projections, you need the financial numbers to show investors what it is that they're going to be getting back or what they can expect. But really, team. The team is probably the most important thing that you can have in place when you're trying to get to that next stage. And that, very honestly for me was definitely a learning point. As a solo entrepreneur, when you start out, you're doing everything and you think that, you will always be able to carry the sacks and close up the store and count the bags and do the spreadsheets and do this and be the cashier, right? And you very quickly realize that, it's neat and it's fun to do that when you're being that small, scrappy startup. But it just is nowhere near reasonable at scale. And so I think if you're feeling like you have proven yourself in terms of having a product that you're confident in and that you think other people will buy into, you look at, okay, what are my core teammates and what are the roles that they fulfill? Are they actually equipped to fulfill those roles? And that's a hard question that sometimes you have to ask. But really many investors, in my view, you know, they look at the product, obviously they want to know that it works and they want to see the projections, but you really need a rock solid team in place, people who are going to carry it forward and take it to the next stage. And those people need to be equipped with the skills, because the skills to take it and scale it are very different from the skills that you need to build it from the start. And so kind of just figuring out that mix of people, I think, is really key.
Yes, sure. Yes, thank you so much, Jeff. Yes, and just like the going says, people invest in people. I think I hear you here when you say at least the team is supposed to be up to stake. I understand it there. Yeah, so Jeff, and now we still have a couple of complexities around when to go for funding or when to go for investment. Understand right about now, looking at your business in the agriculture sector, there's a lot of grant funding, there's a lot of loans going around, there's a lot of VC capital going around as well. But then at times for our ecosystem in Uganda, I think right now we're all still trying to see how we can help innovators, entrepreneurs really become investment ready. So just to understand from you, I know innovators could be having proofs of concept, they could be having prototypes, they could be having MVPs, or they could be having already launched products in terms of digital. But then people don't know at times when to ask and maybe when not to ask, and maybe when to learn to be prepared. So I just want to also understand from you, when do you think is the right time, at least to really just put that coat on, just come and storm the VC, just come and storm the development partner, just to really pitch right on there, at least seek for that fund to either go to get off the ground or to really scale your company in this case.
Yeah, I think definitely you need an MVP. You need something that you can put out there and show people. Those initial, getting to that point is the informal conversations. It's talking to folks in the sector, to figure out, you know, if the product can actually work. My kind of view and take is that, you know, once you have a minimum viable product and you've tested it out here and there as much as you can with the resources that you have, the only way to get better at pitching and raising money and talking to folks about your idea is to just dive in and start doing it. But, you know, acknowledging that you don't want to waste people's time and that, you know, you're putting yourself out there and that's your reputation as well. And so you need to be as prepared as possible to put forward a good case for what it is that you're presenting. But it's really difficult to say when is the right time because every company is different and every company has a different runway. And so my kind of view is that in those first, you know, years when you've got a really solid product that you're moving on and you've moved full time to working on this idea, or you're thinking about moving to full time, you want to bring in and try and get on board an initial small investor, somebody who can back you to see the idea out and give you a little bit of time to get it to the next stage and to help you get to a point of readiness. And so I think you can find some of those folks through the incubators, through the business, you know, competitions and whatnot. And they're not, you know, they're taking on risk and they're taking a chance on you. They're not putting in a tremendous amount of capital, but those folks can be a support system for helping you get to the next stage. And, you know, from there, it's really kind of just dependent on your business. But, you know, I say, if you want to get good at pitching, you got to dive in and start doing it. You know, the last thing is that just for any entrepreneur, I mean, I think I hear this a lot, especially in Kampala and East Africa, much easier to raise capital in the range of 10,000 to maybe 200,000. Very, very difficult to raise capital between 200,000 and say $600,000 or $700,000. And once you get above that threshold, then it becomes easier again. And so just kind of having that curve in mind and knowing that it's going to be very difficult when you get to that middle stage means that you need to place much more importance on the folks that you partner with and that you bring in at those much earlier stages.
Sure. Yes, I hear you there, Jeff. Having of course known that still among the risks that at least also investors look out for is that can this company grow? What does APAC look like in terms of numbers? Will my money come back? And of course, all these are things which really make so much sense to me. But then looking still around our ecosystem, at times innovators and entrepreneurs are at times a bit skeptical regarding some forms of funding, mostly to say equity funding. But then I want to hear from your perspective as well. I know once you decide to grow, you should be willing and able to grow with anyone else out there who's willing to invest in your company. But then I know all the framework around there. At times it can become a bit insecure for the innovators whom probably may think this guy wants to take so much stake in my company. I can't them allowed to do ABCD. So which to me at least is first the evaluation. So how do you think people should first of all evaluate these investment opportunities for funding to at least grow their companies to be profitable in that case?
Yeah, I definitely understand and sympathize with that mentality. You and your team start a project or a company and it's your baby and you work so hard on it and you put everything into it, and then someone comes in, with capital and gets a chunk and gets some control or gets XYZ of your company. And I understand how that, how that feels. And I think the most important thing out of all, no matter what the investor is offering, you need to think about, how do I align with this person? Are we kind of on the same page in terms of what we're going after, what our priorities are? And so that, before anything, is always the most important. In some cases, you do get stuck and you need capital, and sometimes equity is the only way. You just kind of have to find the best partner and make the best of that situation, because at the end of the day, as you're scaling and growing the company, there are very few companies around the world that are at a very serious scale that are wholly owned by one person or one family. It happens, but it's just not very common. Okay, and so what you have to understand as an entrepreneur is that 100% of nothing is still nothing, right? And so you need folks to come on board to help you reach those new levels, because it will also boost you up. And probably more importantly than even the capital, it's another mind at the table, another collaborator there to help you push forward and think about your idea and make it better. And so, I think we all have as entrepreneurs and as kind of business leaders and business owners, we all have our priorities about what we want our business to stand for, what we want our time to be dedicated to, in terms of being an entrepreneur, and so making sure that that's either preserved within your company bylaws and mission and strategy, or making sure that you're very well aligned with the investor that's coming on board, can give you that kind of ease to bring others in and to kind of really grow the business. So there's no real, easy answer to that. It's just the more you meet people, the more you talk to different folks in the space and interact with them and communicate with them, the more you start to understand what different people are looking for and how that aligns or does not align with you.
Sure. Yes, thank you so much, Jeff. I think we have pretty much captured at least each and everything. But then just to remind colleagues watching in online, we're exploring the opportunities with impact-based businesses, just like Latitude Chocolate by Jeff Steinberg. So Jeff, I know our time is almost done, but before, of course, I let you go, I just want to really bring out one critical thing, which I know really defines profitability of a company, which is the legal environment. So I know we're talking about taxes, we're talking about policies not being favorable, and of course, this I'm sure applies to each and every economy. But then I want to understand, how does the dynamics work around how you will really handle taxation, how you handle policies, to at least ensure that you're playing within a favorable environment to become profitable?
I think for any startup, it's definitely very challenging. Not necessarily because of the exact policies and kind of environment that's in place, but because of how much you're doing and how difficult it is to understand everything outside of the realm of your business and kind of what you need to be compliant with. So I think it's a process, and definitely, one needs to spend time, at the outset, building in policies from the start as much as possible, at least the critical ones, and the critical processes to ensure that you're compliant. And then from there, you really need to tap into your networks. And that's kind of what we do. That's part of how our board of directors helps us. That's part of how our various advocates help and support us to improve those policies and consistently be reviewing them every year to ensure that, we're meeting the expectations of, the government, of URA, of our staff, and our partners. And so I think that's really the value of having other folks at the table to help you build those things in place, because there's no question that as a startup and a new business owner, if it's your first time starting a business, there's just too much out there that you don't know. And so, really need to be sharp and smart about bringing the right people in to understand what you don't know, so that you don't get caught up and tripped up by things which are completely separate from your business idea and whether your idea is good or not. And so we've been really fortunate to have great partners to help us, learn how to navigate those environments. And, quite honestly, you learn lessons as well, and hopefully those lessons are small. But it's just a part of the journey, for sure.
Sure. All right. I see our time is up, Jeff. Just to thank you so much for really sharing those interesting insights. Yes, and I know, like I said, that we have investors watching in, we have startups watching in, and I'm sure people are right now wondering what the next step is. Yeah, so for everyone watching in, just to recall is that this can all be supported through enterprise support organizations and incubators with Startup Uganda. And of course, not to say we have a couple of them right now, not only in Kampala, but also outside Kampala. And just like Jeff shared, for you to know how to be compliant, for you to look for investors, and for you to at least really build an enabling environment for you, you really need that network of knowledge, and of course, the networks for investment, and of course, for talent. That's, I would say, the summary of what I hear from Jeff. But of course, not forgetting is now the impact, of course, which can really help you become sustainable, because be it investors, be it partners, they all want to see you really moving forward. But like Jeff said, there's really so much opportunity out there in terms of the value chains around the food supply systems, and of course the agricultural value chains as well. So please just really look out for those. And just nothing else to add, Jeff. Thank you so much. But just also note that, like you said, compliance is the key if you really want to grow. So just like the saying goes right now in Uganda, that you can't grow unless you're growing with government. So that's the only option right now we only have to do, at least to get forward moving. So Jeff, before I let you go, just that one last word to the Kampala Innovation Week community, for everyone who's watching it, for our viewers online and at Design Hub, please just share that one last message, at least to go out to everyone who's watching it right now.
Thanks for having me. Thanks for having us on Kampala Innovation Week. Really excited to be here and excited to kind of tune in and hear all the different panels, and also excited to see what comes out of the various incubators and entrepreneurs who are tuning in. So definitely feel free to reach out, stop by the chocolate shop. There's free chocolate samples for anybody who comes in.
Sure.
You can find us at different stores. We'll be in Nairobi soon, but definitely feel free to drop in for a chat and a conversation. We're always happy to talk to entrepreneurs and investors, folks in the social sector. So thanks for having me, and I really look forward to seeing the next stage of entrepreneurs.
Great. Thank you so much, Jeff. Nothing else to add on to that. just to thank all viewers for watching in, and just like Jeff said, just endeavor to reach out. Yes, so Jeff, my key takeaway was I have to come for the free sample at Let's Reach Chocolate, at least to really ensure that
Please do.
there's really that value for me. Otherwise, thank you so much for Jeff, all viewers. This has been the Makerere Innovation Incubation Center, moderating with Jeff Steinberg from Let's Reach Chocolate. And just to thank you all for watching in, and stay tuned to the Kampala Innovation Week for more sessions to come. All the best. Over to you.
Thank you, Alan. Thank you, Alan. Thank you, Alan, for hosting that session with Jeff. Jeff, kudos to the value that you're adding to the food systems chain in Uganda. Looking forward to testing what the Latitude chocolates, feel like. I'm sure they are an experience. I hope that we've had, the time to pick out lessons from how to create opportunities for profit with an impact-based business. For those of you watching online, please do not hesitate to give us a shout out on your social media platforms. Use the hashtag KIW2021. Talk about how you have grown and created opportunities for other people in the value chain with your impact-based business. Jeff has stated that it takes time. It's not, a job that you do overnight. It's going to take time, patience, but in order for you to break through, you have to give it, the same values: time, patience, and passion. At this moment, I'm very happy that we take an interlude as we ponder on the things that we have learned from this morning's session, right from the conversation from players in the health sector, right into conversations with Alan and Jeff. I'm happy that the team that has organized the Kampala Innovation Week has put aside time for us to have, sessions where we are being entertained. These sessions are also going to stream live on Hubilo and Startup Uganda Facebook page. Startup Uganda Twitter, Facebook, and YouTube pages. Be sure to tune in. At this moment, I would not take as much time. I see that the setup is ready for our entertainment protege. We have Adore Music. They are going to give us an acoustic performance. And perhaps they will also explain what an acoustic performance and how they are able to earn out of, such doing such a business. Is it a business? Can young people earn from, setting up and putting up acoustic performances? I'm quite sure that we've had discussions about how the gig economy is the next big industry. So I want to find out from Adore Music, how are they contributing to the gig economy? Can one guitar feed an ecosystem of people around, the guitar player? So, Adore Music, where is Adore Music? I need us to have a chat just before you serenade us. Or he's changing. He's dressing up, I'm being told, so that he comes to the stage and we're like, wow. Ooh! Put your hands together for Adore Music. So Adore Music, just before you serenade us, I would like us to, get into conversation about, why do you choose to do this particular kind of work? Yeah. So I know you're trying to set up with the DJ about what you're going to tell us. Yes, please take a seat. I'd like to, conversate with you on, why do you do acoustic music? Is it profitable? Are you earning from it, or it's, charity exposure, just in case UNCDF or Startup Uganda, Outbox Hub see you, and then one of the things that many artists like yourself suffer with or are challenged by is pricing. How are you able to price? Or is it inbox me for prices and then you look at the profile picture on a Jacksasula 3 million, on a Jacksasula 500,000. So tell us about, that whole
Hi everyone, my name is Ador, and I'm glad to be here, first of all. So the gig world, all I can say is I'm an artist as well, but being an artist in the country we're in, you can't, we don't have copyright.
Yes.
So being an artist, if you're not signed by a label or someone rich investing in you, you're going to take a while to actually sprout or, you know, make it big. So the thing you do is you try to make money the best way you can.
Yes.
And doing cover performances or weddings or graduations, singing songs that people already know. there's a higher chance for someone who's not famous yet. There's a higher chance for you to get called here and there. Someone saw you here, take your business card, you get, because you need unless for other people who are trying to venture into other businesses, which is harder to balance. So I feel like if I'm doing performances like gigs, let me call them gigs. If I'm doing cover gigs, I'm still in the same field, just that I'm not in the artistry. Yeah, but I'm still in the same field. So that's for that part, I would say. So now about the pricing is, there's some people you look at, okay, yeah, we're in a country where you actually look at a person and you're like, I can price them this way.
Yes.
Yeah, so there are people who call you up and they ask for a meeting. When you meet them, you feel like he actually can pay, for a solo performance, he can pay 2 million. And there's some people who, from the way they talk, the way they carry themselves, you can tell, okay, this guy, if I say 700, it's going to be kawa, because 2 million will be a stretch. He might not even call me back. Yeah, so depending. But usually, there's a fixed price for, you don't go below. It's just like now, to be open for a performance like this, I will get 600,000 for a performance like this, depending on the time I'm doing. And that's a price you don't go below, because logistics in mind, you probably won't make it, like you won't be able to sufficiently keep yourself up if you keep lowering the price.
Yes.
So there's a limit, you don't go below. Yeah, but otherwise you stretch it out while you keep pushing your other music. Yeah, for money from the gigs supports the artistry.
Yes,
slowly.
yes.
Yeah.
So you know, we've had panel sessions that have talked about branding. I just would like to find out, how are you branding yourself? You mentioned business cards. Is it something that, you know, other artists should invest in? Just briefly, before I let you serenade us.
I didn't get the question properly.
Personal branding. How are you branding yourself so that, you know, the person in this room can call you for their next event?
I think the very biggest things when you're branding any package, any product, is the way they look. I believe I look decent enough for a performance.
Yeah.
Yeah. So the first thing is look. Then the product itself, I have to make my best performance. Yes. Then sing one of maybe a favorite song, if it's for the covers. Then of course, if you're singing your songs, you do the best. That's the best way. Then of course, the social media platforms, you call up a couple of friends to help you like align it and try to make it business worthy. But otherwise, it's pretty much that.
All right.
Thank you. One, two. All right, so I'm thinking I should just come closer to these people and then do an acoustic if it's failing. Is it failing? All right, as it comes in. So I'm rolling on your wheel now. I'm drinking Hennessy now. I hope you see now. You done bust my eyeglass. You done scatter my plans. See my eye, you don't press. You put me for one plans. Why made me be? Why made me be? See what you did to me now. God save me, please. Yeah. Now. I know you got me now. Said I know you got me now. Yeah. Said I know you got me now. Sorry about that, but the performance has to go on, I believe. Said I'm rolling on your wheel now. I'm drinking Hennessy now. I hope you see now. You done bust my eyeglass. You done scatter my plans. See my eye, you don't press. You put me for one plans. Why you made me be? Why you made me be? See what you did to me now. God save me, please. Yeah, 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 yeah. Nah, nah, babe. I know you got me now. I know you got me now. I know you got me now. Followed you up and down. Followed you up and down. Followed you up and now I don't lose my mind. Now I don't lose my mind. Now I don't lose my mind. Now I know you lie. The doctor said I passed my liver. I've been drinking, smoking cigar. Used to sing and play my guitar. Now I'm lost in this misery. Everything I do, everything when you walk I do, everything when you smoke I do. You done bust my eyeglass. You done scatter my plans. See my eye, you don't press. You put me for one plan. Yeah, yeah. Nah, nah. Right, so let me do an original composition. It's called Guansanida. Enjoy.
So come make me happy, hug me, baby. Oh, I wanna love you, I wanna be your man, baby. Mulyomu abana mwagala, mukisa okumo mwagala, sanira nyo. Asambera nkubulile kweche wanko.